Imagine waking up in the middle of the night, your heart pounding, and realizing you can't move. You try to call for help, but there's no one around except a small device on your nightstand, quietly listening. With one desperate word, "Save me," your plea is heard not by a person, but by artificial intelligence. Within minutes, paramedics are at your door, and your life is saved. This isn't science fiction. It's the story of Sung-Ja Lee, a 75-year-old woman from Queens, New York, whose life was saved by an AI-powered device after she collapsed from a brain hemorrhage. Sung-Ja Lee's device, called NUGU, is part of a pilot program distributing AI-powered assistance to seniors living alone. When Lee fainted and couldn't reach a phone, she called out to her device, which immediately alerted emergency services. Doctors later said that without such a rapid response, she could have suffered a stroke or worse. In just 8 months, these devices have saved at least 4 lives in Queens alone, providing not just reminders for medication, but a vital link to help when seconds matter. Now, picture the chaos of an emergency room. Doctors and nurses rush to save lives, but every decision carries weight. Enter SaveM, an AI-powered virtual assistant developed by the 061 Health Emergency Center. This system acts as a digital co-pilot for healthcare professionals, providing real-time, evidence-based recommendations during emergencies. By integrating the latest medical protocols, SaveM helps reduce human error and speeds up critical decisions. In recent trials, emergency teams using SaveM reported faster response times and greater confidence, leading to better patient outcomes. But AI's life-saving reach extends far beyond hospitals and homes. When disaster strikes, like the devastating earthquakes in Turkey and Syria, in 2023 AI-powered drones take to the skies. Equipped with thermal imaging, these drones scan rubble for signs of life, directing rescuers to survivors who might otherwise be missed. In Rwanda and Ghana, autonomous drones deliver urgent medical supplies to flood-isolated communities, bridging gaps that would take hours or days for humans to cross. During Hurricane Ian in Florida, AI helped emergency teams cut response times by 40%, analyzing real-time data to prioritize rescue zones and allocate resources where they were needed most. In the aftermath, AI-powered platforms coordinated relief logistics, ensuring food and medicine reached the most vulnerable faster and more efficiently than ever before. In Japan, a woman's life was saved thanks to IBM's artificial intelligence system, Watson. The patient had been suffering from an illness that traditional doctors and diagnostic methods failed to identify. Despite extensive testing and treatments, her condition remained a mystery, and her health continued to decline. Doctors decided to use Watson, which analyzed the woman's genetic data and compared it against a database of 20 million clinical oncology studies. In just 10 minutes, the AI identified that she had an extremely rare form of leukemia, not the more common type she had originally been diagnosed with. This breakthrough allowed doctors to change her treatment plan immediately, which ultimately saved her life. AI isn't just about speed, it's about seeing what humans might miss. In one remarkable case, a 70-year-old stroke patient arrived at the hospital unable to speak. Initial scans showed nothing abnormal, but AI-powered analysis of advanced brain imaging detected a tiny hidden blockage. Thanks to this insight, doctors delivered the right treatment, and the patient regained his speech the very next day. with virtually no lasting effects. From the quiet of a senior's apartment to the chaos of a disaster zone, AI is already saving lives, sometimes in ways we never imagined. These stories are just the beginning. As AI continues to advance, the line between science fiction and reality grows thinner, and the next life it saves could be closer than you think. Subscribe to our channel and leave a comment about what you think about AI in medicine. Our channel is still in development, and we ask for any support for better algorithm reach.